Hi, welcome back, um, Concordia University Irvine students. Excuse me, getting a little tongue twisted there. Dr. D, welcome back. MHA 506 Healthcare Law. Great course, great project milestones, great case briefings, great robust discussion boards. Thank you very much. You know, the goal at the end of this course is for you not to be lawyers. I completely understand that this is not a law class. However, I really appreciate the thoughtfulness that you are using in your case briefs. I want you to start stepping your game up a little bit, especially when it comes to the Blue Book citations. Do your best to kind of work in those Blue Book citations over the last couple weeks of the course. What it does, if nothing else, is just gives you some experience and the ability to see those citations and understand those citations and the importance of going directly to the case and or the rules in order to understand how to navigate through the legal environment in the healthcare field. So congratulations. Thank you very much here. So we are on week 6 where we're dealing with nurse practice in the law and physician practice in the law. And so I'm not going to spend a lot of time on those topics in this lecture. I do want you to know, though, that both of the laws and statutes that govern both of these professions are usually done on a state by state basis. For example, if you are a licensed registered nurse in California, and you move to Nevada or you move to Oregon, then you have to get registered in that particular state and follow the rules and regulations of that state in order to practice. And that would actually be true for a physician as well. I think the major difference between the physician rules of law and the nursing rules of law is that some of the physician laws are also governed federally and enforced by federal agencies such as CMS and the FDA and those are the major implications. But the same thing with the physician. If you're licensed to practice medicine in California and then you move to Oregon or you move to Washington State, maybe you move to Colorado, you would have to get licensed in those states in order to practice medicine. So the net for you is that anytime you're dealing with these professionals, look to state statutes and state laws for your rules of engagement. If you are working on federal programs, though, such as those federal programs offered by CMS, then you will likely have some federal rules and regulations that govern as well. As far as the Christian message this week, you're going to reflect on how the scriptures there that are listed influences your responsibility as a healthcare administrator to provide safe physician and nursing care. The chapter readings for week 6 are chapters 10, 11, and 21 of the textbook, Legal Aspects of Health Administration. I know we're at the end of the course, and some of you are starting to look, towards the finish line here, but I'm going to encourage you to still maintain your same rigor here. Not to mention, you've got that second part of your project milestones that are due, which will be the regulatory plan. And this reading and these videos will help you with that. So please don't look too far beyond the finish line and you're not learning your lessons here in week 6 and 7. Still got a lot of good learning and a lot of good skill building to do in order to get you where you need to be for project milestone and to finish out the course. So please do the readings, chapter 10, 11, and 21. And then there are some really good videos regarding how to manage medical staff, how to understand malpractice insurance, uh, how to organize medical staff elections. So, and that will help you with your regulatory plan. So please read and watch the videos. No self-paced lesson this week. However, there is an audio podcast called Nursing and the Law. Please listen to that. And in your discussion form, after you've done your reading, after you watch your video, you have a scenario where you have a new department director who is onboarding at your physician practice. They are not a clinician by training and question the necessity for them to spend time within the organization's risk management department learning about medical malpractice insurance. So, how would you respond to that based on your knowledge and understanding now of those laws? You continue on with your case briefings. This one's a little more challenging, though. Edward versus Brandywine Hospital. And that was a case back from 1995 that I think you'll find very relevant for this week's content. It may also even help you with your final milestones. And then your milestones is you're going to submit a rough draft to your regulatory action plan. To receive credit, your draft must appropriately address all the elements described in the rubric. Also, I want to let you know that formatting is important too. So by now, you should be submitting everything in APA formatting. So they should be double spaced. You should have your evidence integrated. You should have your font size consistent all the way through. You should have a reference page. And so that's it for week 6. There is no live session. So I'm not going to automatically have office hours on Wednesday. So if you want to connect with me on the office hours, please shoot me an email and we can set up a one-on-one session, or let me know that you're going to log on to the office hours session and I'll be more than happy to log in with you. Okay, thank you very much. I look forward to reading your case briefings and reading your project milestones. Thank you.